This presentation explains how our new Care Counseling program works. If you have questions, please contact the Trust Fund Office at 1-831-757-5265. Our new Care Counseling program is one of 3 benefit changes that are effective as of October 3, 2011. Be sure to watch the other videos on this site to learn about the additional program changes. If you take the time to understand why the changes are necessary and what you need to do, you will save money without sacrificing any quality in your care. We'll start with the rationale for our Care Counseling program. You probably already understand that you pay less money out of your wallet when you use an Anthem Blue Cross network provider. But did you know that the cost for the same service might be very different among those providers? Because you pay coinsurance for many services, this fact can cost you hundreds, even thousands of dollars. Our Care Counseling program is designed in part to help you find quality, cost-effective providers. Here is an example. We used the Anthem Blue Cross online care comparison tool to find a local provider for an MRI of the spine. We were surprised by the results. The cost ranged from $872 to over $4,000 for the exact same service offered by network providers. This can have a huge effect on your wallet because you pay coinsurance for this service. When you choose the lower cost provider, assuming you participate in Plan 2, you'd pay around $175. For the higher cost provider, you'd pay over $800, again for the exact same service. So it's important to understand that you have a choice. You don't have to go where your doctor sends you. You can do a bit of research and save yourself and your benefit trust fund some money in claims costs. So again, this is where our new Care Counseling service comes in. Our Care Counseling service can help you find a primary doctor who coordinates your care. It can help you find the most affordable Anthem Blue Cross network provider. It can help you understand a medical condition or diagnosis and help you with self-care. And it can work with you and your doctor to make sure you receive the appropriate level of care. The service is provided by a specialty health company based in Northern California called Pacific Health Alliance. You can call the Care Counseling service at any time for any reason, and you'll need to call the service before you get non-emergency treatment outside of your primary doctor's office, for example, before you see a specialist, and before you receive tests and procedures at a hospital or outpatient facility. You can talk with your care counselor about the different Anthem Blue Cross network providers who offer the services you need and their costs. You can still visit any provider, but we believe most participants will choose a lower cost option if they know about it. A nurse line is also available 24 hours a day, 7 days a week. Through the nurse line, you can connect with a registered nurse to discuss questions about your health and also talk about your doctor's recommended treatment for your injury or illness and what to expect as you proceed with treatment. You'll call 1-855-754-7271 toll-free to reach our Care Counseling service. The number will also be included on your benefit plan ID card. Representatives are available Monday through Thursday from 7 a.m. to 7 p.m. and on Friday from 7 a.m. to 5 p.m. Pacific Time. If you call after hours, you'll connect directly with the nurse line. And please remember that your conversations that you have through the Care Counseling service are completely confidential. The information you provide will not be shared with your union or your employer. If you have questions about the Care Counseling program, call the Trust Fund Office at 1-831-757-5265. We also hope you will take a look at the Fund's new website. You'll find information about your health and prescription drug benefits, about how your benefit trust fund works, and links to program resources. And thank you again for taking the time to review this presentation.